Good afternoon. My name is George Ferrari, and I serve as CEO of our community foundation here in Tompkins County. Welcome to Let's Talk, COVID-19 Impact Report. Let's Talks are gatherings that we have been doing since August of 2020 on a monthly basis with local leaders in the mission-driven sector to share with us information on what's been going on in the pandemic world and how we've been able to take advantage and learn from new ways of doing things and from working in more collaborative ways. Today, we are joined by, as typically we're joined, but as our presenter today, Jenna Cotraccia is our Chief Impact Officer here at the Community Foundation. We were happy to have questions along the way in the chat box. We'll have folks who are watching for that. And this is being recorded and will be available on our website as well. So Janet, I'll turn it right over to you.
Sounds great. It's so lovely to see so many familiar faces, many of whom I've not seen in quite some time. So welcome. I'm going to dive right in because I have a lot to cover today. Firstly, I just want to thank you all for this opportunity to reflect on this impact this last year and to look a little forward as well. I'm going to cover 4 priority areas around mobilizing financial support, facilitating communication, supporting sector health, and supporting access and prioritizing racial equity. In March of 2020, as you all likely know, we established the COVID-19 Response Fund. To date, it has raised almost $400,000 thanks to the generous donors in Tompkins County and beyond. It provided a vehicle for donors to give to meet basic needs, and really, it's an opportunity for the model of a community foundation to really shine, because this is one of the important roles we can play in our community. In addition to that, we launched the Resilient Communities COVID Rolling Grant Cycle, which targeted basic needs. I'm going to give you some, for people who like the data, I'm going to give you some big picture stuff. For total 2020 grant making, we granted $2.3 million in 572 grants in 2020. In addition to the COVID-19 Response Fund, we also have 139 other funds in 2020. You'll see here most of those of the funds are grants are made from donor advised funds, of which we had 81 of in 2020. And this red pie slice here is the COVID-19 response. We are mobilizing grants. We do a lot of communication and information sharing that mobilizes additional grants. And we made grants to 133 different local organizations in 2020. This gives you a little bit of an idea of the average grant size. So the average grant size in 2020 was $4,057. The average grant size from our COVID response fund was $6,770. The majority of our grants are under $5,000, but above $5,000, you'll see that many of those grants have been inspired by grant cycles or otherwise match made by staff. So 47% of all of our grants resulted because of information gained in a grant cycle or an application request or otherwise shared internally. There's 4 areas I'm going to talk about. Food security, obviously one of the biggest areas of interest of our donors and of our community as a whole. We supported many food serving organizations, many of which are long established, like the Food Bank of the Southern Tier, Loaves and Fishes, Healthy Food for All, Nourish Tompkins, GIAC and Southside hold endowed funds here at the Community Foundation that support food security. And we also, through some of those organizations and individually supported organizations like Mutual Aid Tompkins, which evolved very rapidly as a grassroots response to food security throughout Tompkins County. Given the large number of food serving organizations, we also focused efforts on the coordination of food distribution. We can distribute a lot of food, but if we're not getting it to the people who need it most, then we're not doing our work. So a lot of our emphasis was around supporting the Food Task Force, which convened these many food serving organizations. So for example, in addition to the traditional grants to organizations like FoodNet Meals on Wheels, which assists our aging population, we also helped them shift to serving some emerging needs. So it was identified pretty quickly that, that individuals who are being quarantined may have had some food insecurity prior to quarantine, but certainly needed some services to be able to provide food to people and families sometimes being quarantined. Health. We made a grant to Cayuga Medical Center to support the purchase of testing equipment. We made grants to Ithaca Car Share to help provide transportation to testing sites, particularly early in the pandemic when you needed a car to be able to go through the mall testing site. And then grants to the REACH project, for example, which provided testing and a range of other health services to our homeless encampments and other vulnerable populations in a very sort of rapid response and strong relationship development manner. And we did this in concert with many other local funders, which I'll talk more about. Mental health services certainly have been in great need throughout the pandemic, and that has not subsided. Grants to Family and Children's Services of Ithaca supported their technology infrastructure, as well as grants to organizations like Cayuga Addiction Recovery Services to help them move to the telehealth environment to maintain the standards of service that they were accustomed to, but to be able to shift to the virtual environment. Childcare. Childcare models rapidly shifted as people moved to remote work. While most childcare centers closed immediately with the pandemic, there were some very strategically opened in limited capacities to provide services for essential workers, which were desperately needed in those early days. Grants have primarily focused on the Child Development Council, but as they work with a wide range of childcare providers throughout these changing times. But we've also worked with organizations like the Downtown Ithaca Children's Center as they support a predominantly lower income households, as well as families of color who've been disproportionately affected by the pandemic. Case Gomber and her staff have provided amazing support to young children, providing resiliency and support for young families during these trying times. And then a host of other basic needs. So the Advocacy Center addresses domestic violence, which is on the rise over the course of the pandemic. Catholic Charities providing personal care items for people in need, and as well as a host of other services. Love Living at Home, supporting older adults who can otherwise be isolated. Family and community development connections with residents of local trailer parks in our rural communities, and they needed to provide some technology support to those households so that they can maintain in these higher stress environments those types of relationships. Fingerless Reuse providing employment and job training, Ithaca Neighborhood Housing Services, and a host of other housing services. Lots of preparation going on in anticipation of the eviction moratorium being lifted, and very strategic planning around that. And that's some of the other ways we mobilize financial support is sort of how we do our work. So we streamlined our application for our rolling grant cycle for COVID support to make it easier for applicant organizations to be able to get across what their main needs are and to respond quickly. We turned those grants around quickly, often in less than 10 days. As I mentioned, those grants could be requested up to $10,000, the average grant size I mentioned earlier. And we really wanted to remain flexible. Organizations went into immediate crisis. We would respond to some of those, but then PPP started coming through. And as that federal funding would come through, organizations would get some relief. And so the nature of the types of support they needed was changing over the course of the year, and the grant cycle was able to respond in a flexible manner accordingly. We also do a lot of work listening to communities. I'll talk a little bit more about some of the ways we do that in coming slides. And we're strategic in recognizing, a lot of people forget this, but we can't make grants to individuals. We make grants to 501c3 organizations predominantly, but we were strategic in how we noted that sometimes it was financial support that was needed most by families in need. So we supported entities like, or the Food Task Force mini grants, so that dollars could be mobilized to individuals or small groups that were convening that were not sort of 501c3 organizations. And I want to do a specific shout out to my my Resilient Communities COVID Rolling Grant Cycle Review Team. So this was our Rapid Response Review Team. It was a 7-member team. Travis Brooks, Christine Barksdale, Theoria Kaysen, Keith McCafferty, Linda Matteo, Susan Murphy, and Ann Martin. They met 26 times, reviewing 76 applications and updates, and mobilized over $330,000 by December 31st. If you see these people in the community, sing their praises, thank them for their amazing work. And they, like so many others in the Community Foundation, have just been doing really, really astounding work in service to our community. Second area I want to talk about is facilitating communication. One of the things that we did very quickly early on was convened our local group of funders. This is a group that historically had met maybe 3-4 times a year. We, at the beginning of the pandemic, were meeting twice a week. This group worked really hard to identify emerging needs. We shared a lot of information with each other, and we're all attached to sort of different groups, different information sources. We invited experts in to present to us, to tell us what those pressing issues were, and we shared the requests that we were receiving with each other so that nonprofits didn't bear the weight of having to apply to multiple different organizations, and that we responded with a host of collaborative grants and individualized grants. So I can't go through all the grants. There were so many grants made, but here's Amy, I think, is going to put a link in the chat for you. You can visit that link and see an updated list of all of the grants from our COVID Response Fund. And you can also visit our website at CF Tompkins and go to Grant Opportunities and Grant History, and you'll find a link to that. We also facilitate communication. Our staff, as well as our foundation representatives, our board members, our committee members, are involved with a huge variety of different groups and entities throughout Tompkins County. Only a smattering, a rainstorm of things that I thought of that we regularly get report backs from, and our community volunteers are engaged with. And then, of course, we launched the Let's Talk series and had hosted a host of informative individuals who could tell us what was going on in the particular area of expertise that they carried. Next week at our May Let's Talk, we'll be hosting Kate Shank's Booth, the Executive Director of the Tompkins County Youth Services Department. She'll be talking about summer camps, only a few of which were open last summer, and many, many more opening this summer. And she's convening those groups. They're learning what the best practices were last year and how to roll it out this year. You'll want to join us for that. We also support the health of the mission-driven sector. We regularly consult with regional and statewide funders. We're part of the New York Funders Alliance, which convenes us as local funders. We learn a great deal about what's happening in other communities. What are the creative solutions they're applying? How can we apply those? And we share the things we've learned with them. We also support flexibility. When at the beginning of the grants, the pandemic last year, we had obviously a host of grants out there in the community, some of them substantially sized, and said, we reached out to them and said, all right, how can we release these restrictions for you so that you can be nimble in assessing and adjusting services along the way. We also consult with individual organizations. I meet with probably a half a dozen nonprofits a week and talk about a wide variety of issues. Sometimes it's around how to get funding from the community foundations. Sometimes it's relationship building. Who's doing what in this arena? Who should I talk to? And because we have this bird's eye view, we do a lot of connecting and information sharing. We also engage in cross-sector support. The mission-driven sector is tied not to the health of our public and private sectors as well. We made a series of small business loan grants last year that was in collaboration with local government and AFCU. And we're also very strategic. I mentioned the technical support we've provided to organizations. Mental health support remains a hot issue to our local funders group, and always looking for creative ways to be responsive in service to the mental health needs of our community members and residents, but also the employees and those who carry out the good work of the sector. I mentioned the Food Task Force earlier as being an innovative model that provided that coordination of services, and they dealt with issues around distribution, but also around production, how to maintain, how to match up local farmers and the sustainability of those local farms in meeting the local nutritional needs within Tompkins County. And something that, so you might recall last year was our 20th anniversary. our attention got shifted toward more pressing needs, but one of the things we had planned was to do a grantee survey last year. And we realized pretty early in the pandemic that we were still committed to doing that. We needed to know if we were being responsive in the areas that were of greatest need. So our Community Impact Committee, spearheaded by Ann Martin, convened a ripple effect mapping process, of which a number of broad themes rose to the top, that our grantees felt that the Community Foundation carried out small grants, but it sustained big impact, that those grants were flexible and nimble and responsive, that we were trusted by our grantees, and that we trust our grantees, and that we play important cross organizations so that they can develop mutually reinforcing activities, and that we play substantial leadership roles in the community. We have would love to share more information about this survey with you if you're interested, but you'll see quotes throughout this PowerPoint reflecting that. Our last area is supporting access and prioritizing racial equity. Oops. Some of you have seen this before. After the killing of George Floyd, we recognized that we needed to take a deeper dive into how our grants were or were not advancing social justice and more specifically racial equity in our communities. We started developing definitions of terms, that how do we define social justice? How do we define the priority areas within social justice? And we did a 3-year analysis looking back to January 1st of 2018 and identified that 79% of our local grants over the past 3 years have had a social justice emphasis, 9% of which have focused on racial equity specifically. We are in the beginning stages of this, and we're excited about continuing to set goals, particularly as part of our strategic planning process, which we are currently embarking on. And other ways that we continue to value and strive to model these priorities is the democratization of our decision making. We have so many funds within the Community Foundation, and it's certainly not me or staff represented teams that are all directing grants from the funds within the Community Foundation. And we work really hard to engage people with lived experience on those teams and to build social capital. We foster leadership at our events by sharing the microphone with others, new voices in our community. We've done this for years and look forward to new opportunities to do that. And we're currently supporting workshops like the DEI series that's currently being carried out with the Chamber. We continue to take risks supporting emerging issues, programs, and leaders. We often are the first money in with an emerging issue or organization. We're willing to take the risk and to say, let's learn from this passionate group of individuals or leaders. And then we watch as they gain greater credibility and other local funders start funding them over time. And all of a sudden they have a strong established voice in our community. And we watch this pattern. It's not even, well, at any rate. So using, I mentioned building social capital, continue consulting with applicants and potential applicants, events, and creating spaces for people to build lasting relationships and use a lot of tools around ground rules to create safe spaces for those things to occur. And we also function in many ways as culture creators. We've embraced the collective impact model in recent years, and it's really fostering collaboration across organizations, which we see the fruits of during this pandemic, as these organizations know each other well and have been able to work closely together. We encourage proximity with marginalized groups, and we carry out a practice in our applications of asking organizations to do exercises in self-awareness and self-assessment. And so we talk a lot about not what is the work that we do, but how do we do our work? And a lot of the racial justice literature in philanthropy right now is around the importance of how work gets carried out being transformative and the impact that's created. So looking forward, we are, if you weren't at the Q&A, we have shifted the priorities of our spring grant cycle from program-centric to general operating. And there's a video on our website. If you missed that and want to learn more about it, I encourage you to watch that. Our COVID rolling grant cycle is no longer posted, but the COVID response fund remains. And like with many of our other funds, we'll continue to respond to the needs in our spring grant cycle and other needs that we learn about. Feel free to contact me or other staff to inquire more about that. We're dealing with, I'm hearing more fatigue and low morale with a lot of those organizations that have been working really close to vulnerable populations and really in the past year. I encourage you to reach out to those organizations that you're close to, see how you can volunteer, tell them they're doing a good job, do the kind of support that they need, and bring those ideas to us on how we can work to advance those priorities as well. Watch in the coming months, just as when the pandemic was starting, new issues were emerging very quickly. We're going to find that moving out of the pandemic as well. The new hybrid environment is going to create new challenges. Learn about those. So
Janet, I'm gonna jump in.
We also don't know what we don't know. So we're
Janet, I want to jump in here because we have less than 10 minutes remaining. I want to save some time for questions. And I know that you're going to be able to share the PowerPoint. We can share it with other folks. And I wanted to really, people ask us a lot of interesting questions. I want to make sure we get to those things as well. So Amy is on staff looking at questions that are coming in. I also want to acknowledge and thank the fact that we're able to do all of these things because of the generosity of our local community and of local donors. Community foundations only exist because of the support of folks like you on this Zoom. So I want to acknowledge and kind of thank that. But Amy, is there a particular question we want to jump in on right here while we have some time here before 12:30?
Absolutely. And we can just start with this one. It goes along the lines of community foundations. So someone was recently surprised to discover how many different funds the community foundation manages. And a kind of a question or a thought is it efficient? Does it mean that there is more bureaucratic overhead than there would be a good idea? And apologies if it's a, surface kind of question.
Now that's fine. And part of the role of community foundations is to aggregate the resources we have to benefit from our investment expertise, our grant making skill, our knowledge of the community. That's all shared in synergistic, synchronistic kind of a way. So that's part of what a community foundation does.
Great. Was there a main takeaway from the ripple effect survey, like in terms of what's the most important impact? For example, was it something like the speed at which funds could be accessed that mattered most? And will there be like a post and a gathering of the information from the full survey results?
Great question. So, that the results and analysis of that is being utilized as part of our strategic planning right now. So we will be continuing to that. Those 6 areas that I presented were the main thematic areas that were drawn from that. I think one of the things is essentially we need to be doing this more regularly. We need to be engaged in grantee surveys in a more regular and frequent process to assure frank and helpful and candid, transparent conversation between the types of services we provide and the type of needs in the community.
Another question that has been asked is, I would like to know more about the efforts to bring the vaccine to communities of underserved people or those who are vaccine resistant.
Yeah, great question. So I mentioned some of the groups that are working like in particular demographic areas rurally. Pretty much all of the conversations I'm having at this point with organizations, we're talking about how to reach hard to reach populations. And we've had keynotes, we've had individuals come to this Let's Talk series, talk about how to meet the needs of individuals with disabilities. I know that there's some efforts being made right now to provide home visits and do the vaccinations in people's home and be sort of the first candidates for that. Fortunately, Amy Hendricks from The county has been on our local funders group and is providing outstanding updates to us on the vaccination efforts. And so, yes, that's definitely hot on people's interest areas.
One of the questions, Janet, that I thought was very interesting, because we're thinking about this, I know, a lot at the foundation. Are there one or two things that we've learned as an organization that we will continue doing going forward? The opportunity that this pandemic gave us to learn something new about how we do things differently.
Yeah, it's a great question. I think that the move toward more flexible funding, it's not new information, but it's reminded us of how important it is. So providing general operating support and very flexible funding, trusting organizations to meet the needs where they are greatest in a continuously changing environment is so important. And so this is a substantial shift for our spring and fall grant cycles this year, away from being meeting. And so our commitment to continuing to build an infrastructure that supports that. I think we need to continue to engage in philanthropy education locally and remind donors that that's where the greatest need is as well.
Foundations in many ways are built for responding to emergencies. This is an emergency that's almost inconceivable, right? So with disaster relief and other sorts of issues, and you can see across the country community foundations being instrumentally involved in doing this, often in partnership like we did with our approach with other local funders as well. Amy, do we have additional questions at this point?
Yeah, so another question, and it can kind of expand out a bit as well, is can you share a little bit more on impacts and responses for teens dealing with pandemic-driven changes in their lives? We're certainly a college town, but teens and also our rural communities, certainly, you know, things affect very differently.
Yeah, both really important areas. Some of the observations that, for example, Family and Children's made was that historically the referrals they would get for youth, they anticipated a growth in all their referrals for mental health services. But because of the virtual environment of schools, teachers don't have the same, you know, close eye on what's going on with kids and their in the stressors that are that they're going through. And so while they saw an increase in referrals for adult mental health and therapeutic services, they actually saw in the early months a little bit of a decrease in, and that was a sign that, you know, the needs of kids were not being met. So they've, you know, worked hard, as well as other mental health serving organizations, to reach out to and convene with other nonprofits that are working closely with youth. But I think that is one of the areas that we're going to find. I know that there are youth that didn't ever really tap in very effectively to the virtual learning environment. And there's a lot of questions hanging out there about what's happening with those youth and what are we going to learn in the weeks and months ahead. But having said that, the efforts of our school districts, both our rural and Ithaca City School District and the nonprofits that work closely with them, did an outstanding job in terms of food security and finding creative ways to get books delivered with food and creating other sort of informal networks for checking in with our local youth and providing the technology in a rapid way, recognizing that there's still limits around internet, you know, connectivity in some of those communities. So there's always the good, there's the wonderful success stories, and there's those vulnerable communities that we are going to likely learn more about in the coming weeks and months. And rural communities, in some ways, you know, the Groton Public Library just has throughout many years now building up some food security related services. They've just exploded with that and worked really vibrantly with their with the local community and a lot of cross-sector engagement to mobilize food. We've seen that in Newfield, the Enfield Food Pantry, and we've seen, you know, a community center opening up in Enfield. Lots of great rural services, but very, very intentionally defined as part of our social justice model, because rural services is a priority area. We need to be continuing to draw attention to communities that even pre-pandemic could be isolated in many ways. And so creating access for services in those communities is paramount.
Jenna, I want to thank you so much for, this is what we jokingly refer to as sipping from the fire hose of philanthropy. It's not intended to be a be all and end all. This is not your only way of asking us questions. Community Foundation staff are available through our website at cftompkins.org. All of our emails are there. We love it when you ask us questions. We love it when we're able to share information. We will make this recording and the PowerPoint available, archived on our website, and following up with emails to you as well. Our next Let's Talk is May 4th. Star Wars Day. That will be with Kate Shanks Booth, who is the director of the Tompkins County Youth Services Department, talking about summer camps. It also, here's a little bit of a interesting maybe trivia for you. It is the day which the Community Foundation was incorporated. Our incorporation certificate lists May 4th, 2000. So that's a Community Foundation birthday. And we will continue to do this. And considering how much information we've tried to pack into this, it might make sense for us to do COVID-19 part 2, maybe 5-6 months from now in October, with a little bit more perspective, a little bit more reflection on what we're doing. So I want to thank you so much. I want to thank donors who make this possible, partner organizations who do the work, an amazingly strong community who's pulled together to be resilient and supportive in how we rebuild from challenges like this pandemic. Thank you so much.